There's one thing that I feel is conspicuously absent from the ranks of the United States Air Force that is present in the other four branches of the military, and that's the warrant officer tier. They are between enlisted and officers and are considered highly trained technicians that are experts in their field. It's my belief that the Air Force Independent Duty Medical Technician, or IDMT, should fill this position. The IDMT starts off as a 4NO, or Aerospace Medical Service Technician. After they have at least 4 years in the Air Force, they can apply for this position. The technical school for IDMT is approximately 4 months long and is taught by physician's assistants and MDs. The training in this course goes over anatomy and physiology, history and physical exams, dental treatments, medical treatments, diagnosis, therapeutics, public health, and bioenvironmental and engineering procedures. The Career Field Education and Training Plan for an IDMT greatly expands on that of a SLIC 4NO. It includes many things that are typically performed by a medical officer, either a doctor, nurse, public health officer, or bioenvironmental engineer. The scope of an IDMT, or the scope of practice of an IDMT, is similar to that of a physician's assistant. They are actually doing diagnosis and providing treatments to the patient, rather than just doing administrative tasks and doing assisting, which is what a SLIC 4NO does. Assignments for an IDMT are they're very broad. You can be assigned to a medical group where you're typically doing administrative tasks like as a SLIC 4NO. And you're also typically supervising people, so you're actually rating on somebody rather than providing care that you're trained to do. I feel that this is an underutilization of the career field in that you have somebody who is very trained and they are going back to their basics of their career field rather than being used to the full scope of their practice. When they're assigned to an operations group, the IDMT is typically in a squadron medical element, which consists of a flight surgeon and two IDMTs. In the deployed environment, these three personnel provide round-the-clock coverage for all base personnel that are assigned to them. In this position, they're given greater autonomy rather than in the medical group where they're actually seeing patients. If an IDMT is assigned to an isolated location, they're going to be the only medical personnel on that facility, and they could be giving care to everybody from an airman basic to a general. And it's just going to be them by themselves, and they have no additional backup at all. You're probably wondering, why should an IDMT be a warrant officer? As I said before, they typically perform the duty of an officer. They are the medical personnel in a lot of situations. They also have the medical authority of an officer in that they are placing patients on quarters and they're giving strict orders of what patients need to do to better their health. Making an IDMT a warrant officer would lessen the supervisory requirements. Rather than having to rate on airmen, they can instead just do their core tasks of providing care and giving training to those that are not IDMTs. This also would prevent junior members from giving orders to senior members. For instance, you could have a staff sergeant who is an IDMT who has a master sergeant who is working for him as a SLIC 4NO. This way you don't have a staff sergeant telling a master sergeant what they need to do for their job. This would also give a distinction between enlisted assistants and officer providers. Because the IDMT kind of bridges both of those gaps, it puts them right in the middle between the two. And also with the warrant officer billet, it allows the IDMT to perform as they're fully trained rather than being in a 4NO billet in a hospital where they, as I said, they're doing those supervisory tasks, they're doing administrative tasks, when instead they can be providing patient care around the clock. The Air Force Independent Duty Medical Technician is a highly trained enlisted medic. They are trusted to maintain the health of all airmen, as I said, from airman basic to general. They are underutilized and underappreciated in the Air Force at this time, and I feel that as a warrant officer, they would be better utilized in that they can do their job as they're fully trained. Thank you.